Hey, what's up, everybody? Today we're going to talk about our largest organ, and that's our skin, and how to keep it healthy and youthful. I'm Risa Morimoto, your host. I'm an integrative nutrition health coach, and you're watching Modern Aging, where we chat about innovative and holistic ways to elevate our health and well-being as we age. I'd love for you to subscribe to the channel. If you haven't done so already, just click on that little red button below with that little bell next to it to be sure to be notified whenever a new episode is uploaded. I'd also love for you to check out the website at thisismodernaging.com for our latest articles, events, and programs. So today my guest is dermatologist Dr. Mamina Turagano. She is triple board certified. She's also an internist, and she's also a dermatopathologist who's based in Louisiana. Dr. Turagano, she has a really holistic approach to evaluating how nutrition, lifestyle, sleep, and other environmental factors play a role in aging and cancer and inflammation. I actually interviewed her, Mamina, Dr. Mamina, and her mom on a video, which I'll just put up here. You can link to that, where we talk about her Japanese mom's special secrets that have actually gone viral on the internet. It's pretty crazy. Dr. Mamina has a super fun Instagram and TikTok that you could often see her dancing and teaching us the best ways to treat our skin. So check it out. Skincare is always on top of mind for most women. And I know that you're a triple board certified, you're a dermatologist, you're an internist, and you're a dermatopathologist.
Dermatopathologist, yes.
I can't even pronounce it. But so tell me a little bit about your background in dermatology and how you got here.
Yeah, I actually didn't decide that I wanted to be a dermatologist until I was doing my clinical rotations, which was my third year of medical school. And I was doing it in internal medicine, in a subspecialty of internal medicine called rheumatology, which I was very interested in. That focuses on a lot of autoimmune conditions like lupus, but with a lot of autoimmune conditions, there's a lot of skin conditions, skin diseases. And I was really drawn to those people. I really just had a lot of empathy for those patients who were dealing with a lot of these skin issues. And I was like, maybe there's something more to dermatology than Botox, which is, yes, definitely so much more to dermatology than Botox. And then just coming to learn about dermatology, I did a rotation in it. I mean, I liked treating both adults and pediatric population. And so you can do both. There's a little bit of surgery, which was great. I didn't like the big major surgeries where you open up people's abdomens. I like just small little surgeries. And then, of course, there was a huge pathology component. We have to know what every skin disease, and there's thousands of diseases, we have to know what they all look like under the microscope.
Wow.
And that really helps us understand how the disease works. And it just also helps us understand why a disease looks the way it does, just from a non-microscopic view, just looking at it. And then, so I really enjoyed pathology when I was in med school, but I wasn't sure that I wanted to do a pathology residency. You know, pathologists, the stereotype is that they're just in a basement under the microscope all the time.
Right. Not so fun, but fun for some people who don't like to see other people.
Right, exactly. And I do like interacting with people.
In terms of what you do now, do you do your general kind of skincare, prevention, anti-aging prevention? I hate the word anti-aging. I feel like it should be like healthy aging, but
yes. Yeah.
Do you still treat people who have autoimmune disorders as well?
For sure. Yes. Yeah. I see a wide variety. So like my typical day will have acne patients, eczema, psoriasis, warts, some people who have autoimmune conditions, and there's a lot of skin diseases like vitiligo, which is this condition where you lose pigment in your skin. You get like a white patch. That's an autoimmune condition where immune cells are attacking your pigment producing cells. And then of course there's cosmetics. There's a little bit of Botox, Dysport, fillers. There's also surgery. I do skin cancer screenings all day long. So I look at people from head to toe. And I do a lot of biopsies. And that's why we have to know pathology so well, because we remove so many things, whether it's an atypical mole or a skin cancer, or we have to biopsy like a weird rash that we're not sure what's going on. So yeah, we're doing a lot of procedures. And so that would be my typical day. But definitely with a lot of my patients who come in, especially when they come in for their skin cancer prevention screening, we will talk a lot about skincare and just what's in a basic skincare regimen. And sometimes they will need prescriptions too.
Wow. So can you tell me a little bit about how you see the link between like lifestyle and the health of your skin?
Yeah, I think that that's a very important link. A lot of people think that if they slather on this expensive night cream, that it's going to miraculously make them look 20 years younger.
Wouldn't that be
And
nice?
wouldn't that be awesome? And don't get me wrong, like the skincare industry is booming. It's like $1 billion industry, but there's a lot more than just skincare. Um, so, when it comes to aging, things that can promote aging are things like inflammation, and stress. And so in our everyday life, doing those things to reduce that. So when it comes to inflammation, there are certain foods that can be more inflammatory or more damaging to our collagen. And and also when your body is going through inflammation, it's working harder and that can age you faster too. Seems like common sense, but when it comes to food, like avoiding processed foods as much as you can. Foods high in sugar have definitely been shown to affect your collagen for sure. It's been shown to like make collagen weaker and break down faster. Processed vegetable oils as well. There's still a lot of gray area, and I think there still needs to be more research because also everyone responds to foods differently. For some people, dairy can be inflammatory. For some people, gluten can be inflammatory. But something that we see consistently is just more processed foods and like sugar.
So tell me about what do you do?
So, in terms of skincare or my
Skincare and lifestyle.
and lifestyle, well, when it comes to skincare, I try to practice what I preach. And I do think that everyone's kind of different depending on your age. So, I'm in my, giving away my age, in my late 30s. And so that's when a lot of, signs of aging can come out. Definitely when I see my patients starting in their 30s, that's when I start seeing more complaints. Definitely in the 40s and for sure 50s and 60s. And so in the morning, I cleanse my face. It might just be straight water or it can just be with a gentle cleanser. And then the next thing I do, which I think is very important, is using an antioxidant serum, namely vitamin C. Vitamin C just has a lot of potent antioxidant properties. And so what that does is that it helps prevent your skin from being so affected by the everyday, I guess, stressors that we encounter. So UV light, pollution, some people smoking. These things cause what are called free radicals. Free radicals are these unstable molecules that can damage your DNA. And what antioxidants do is that they bind to these oxidizing free radicals. So that's why they're called antioxidants. These radicals oxidize or break down your DNA. So they bind to that and help prevent those from causing further damage to your skin. And so vitamin C is a prime example just because it's considered to be a very potent antioxidant. It doesn't replace your sunscreen. So just a sunscreen does more for UV light, but the antioxidants can definitely play another role in prevention.
Oh, wow. And so you
Yeah,
take that as a serum or as a cream or a...
that's a great question. It can come in different forms. I think that it most commonly comes in a serum form, like a liquid form. But there are certainly different brands, wonderful brands out there that make lotions and cream versions of it. Mm-hmm.
What are your thoughts on what is it called? Hyaluronic acid?
Hyaluronic acid, yeah. And I'm trying to think if I'm using one right now. I don't know if no, not in my current moisturizer. A lot of moisturizers contain hyaluronic acid. I'm sure one of my moisturizers that I'm using now has it, but you can also get a separate hyaluronic acid serum. The role of hyaluronic acid is it's what's called a humectant. A humectant is what draws water, whether it's from the environment or even deeper layers of the skin. It just draws water to itself. And by doing that, it can have like a hydrating effect, but it can also have like a plumping effect. So it can really help with like dry, dehydrated, wrinkly skin too, just kind of nourishing it, hydrating it, plumping it up a little bit more. So that's definitely a nice ingredient.
Oh, probably especially during the winter too.
During the winter, yes. Yes. But yeah, it's great to use all year round. But during the winter, that's when we're seeing a lot more dryness. And so moisturization becomes more important during that time. But yeah, and then yeah, so some type of moisturizing ingredient, whether it's hyaluronic acid or some type of moisturizer, and then a sunscreen on top of that for my morning routine.
Do you
And
always recommend, I've heard, don't do anything under 50 plus or that sort of.
that's a good question. Yeah, the general recommendation is SPF 30 or higher, since a bulk of the studies on sunscreen were done with SPF 30. But there are more studies now that have come out that are showing that really the higher you go, the better it is. I mean, we were under the impression, I mean, and it's true, like there's not a huge difference between SPF 30, 50, and 100. But when you are going to be outside for prolonged periods, that's when the difference is more apparent.
Right.
But for daily use, you can, I would say 30, 30 to 50. Mhm.
That's awesome. So do you, I don't know if this is controversy or, because some people say, oh, there's such a lack of vitamin D now in people that don't worry about the SPF. You should just go outside and get vitamin D. I mean, do you have any thoughts on that?
Yeah, that's a really good question. So, vitamin D deficiency is definitely a very prevalent phenomenon in our country and probably in the world. And it's unclear why. I mean, I'm not sure if it's the way people are absorbing it is different, or the fact that we're just indoors way more often, which that's probably playing a huge role. And and honestly, the most effective and efficient way to get vitamin D is through the sun. Um, but as dermatologists, it's just we just see how much UV rays, just because I think also with our environment being different, I don't know if the ozone layer is more depleted. It's just the UV rays are just more damaging too now
Right.
than they were however long ago. And so we still discourage people from getting their vitamin D from the sun, and we recommend supplementation. Um, but but you and I don't know where this is cited, but you can still get ample vitamin D with 10 minutes of sun exposure. And if you want to, if you're concerned about aging, you can certainly, still put sunscreen on your face and just get a little sun on other parts of your body. If you're going to be outside for more than 10 minutes, I would definitely recommend putting sunscreen on your extremities after that. But you can still get some, you don't have to be outside for that long to get a good amount of vitamin D.
Wow, that's good to know. Actually, I did not know that. Um, so, how important do you think a skincare routine is for people who are concerned about, aging skin or other issues that kind of tend to arise as we get older?
Yes, it's a great question. I do think that skincare plays a huge role with skin health and, diminishing the signs of aging or preventing signs of aging. And if you were to pick any one thing, you could like I said, you could buy expensive creams and serums and whatnot, but if you are not wearing sunscreen every morning, then there's just no point in doing it. Sunscreen is it it gives your cells a chance to take a break from working. It gives your cells a chance to take a nap. Like, because when you're exposed to UV light, and even indoor lighting too can activate your skin cells, but your skin cells are like working hard to protect themselves from the potentially damaging effects of those lights. And sunscreen is able to just preserve your skin, your cells, and just allow them to, rest and recuperate and regenerate.
Well, I think in our very busy world, in our busy lives, we kind of take a lot of that stuff for granted. And then until it's too late
Sure.
or until it's like, oh God, what's happening?
Right. I know.
Um,
And I'm trying to find a way to make sunscreen seem more glamorous, because it doesn't seem like that cool to put sunscreen on. And some people are discouraged because it makes their skin look weird and stuff. But there's so many sunscreens now that look really nice and blend in really well. And, you can buy sunscreens that also have other anti-aging properties in it, like other antioxidants, and just do it all in one and not have to think too much in the morning.
so what is actually happening? It's kind of funny. Like in my 40s, I started to notice a bit of a change. And literally, I feel like on my 50th birthday, I was like, what? It was just, and it's like the neck and, near your eyes and stuff, and you just notice a change. So what is
Yes.
actually happening?
Yes. So really good question. Our hormones are changing too, and that plays a really big role in just the collagen, the thickness of our collagen. And as we age, collagen eventually becomes thinner and it breaks down. And so that is what manifests as wrinkles, because when it's thinner, then like it's easier for wrinkles to show through. And also as we age, just thanks to gravity, volume tends to drop. So when we're younger, our faces look more like a V, and as we get older, things tend to drop and collect, and people get like the jowls and like just heaviness more on the lower face. And so that's a big role. And then another thing that happens as we get older is that our skin cells do not turn over fast enough. So typically our skin cells, you know, they exfoliate after a certain period of time. And then, once it exfoliates, it keeps your skin looking even and bright. And if we're not exfoliating as often or as adequately, it can result in like uneven skin tone, pigmentation. So
Hyperpigmentation.
and hyperpigmentation, which is a huge sign of aging.
Yeah, my
Hmm.
sister reminds me every day.
Yeah, yeah, hyperpigmentation is definitely a thing. I think a lot of people do focus on wrinkles, but hyperpigmentation is all part of that. It's a lot of it is um, the effects from the sun that stimulate the skin cells to produce pigment. And
So
yeah.
hyperpigmentation is essentially like age spots, right? Or is it?
Yes. Well, so I guess hyperpigmentation is more of an umbrella term. Hyperpigmentation is anything that's darker than, the surrounding area. So there's different types that we see in dermatology. We see in kids and young people, we see a lot of post-inflammatory hyperpigmentation from acne. So it's like dark marks left behind from acne. But yes, and then there's also hyperpigmentation conditions like melasma, which we see in a lot of, I mean, we can see it in all ages, but typically women in their 20s, 30s, 40s. Over, just brown patches over their face. And then another form of hyperpigmentation are age spots, sunspots, solar lentigos is a formal name. And some people will call them like liver spots, but
Right.
yeah, freckling and larger spots are yes, signs of, aging or sunspots.
Oh, wow. Oh, my God. I hope
There's
people watching this aren't too depressed now. Um, but there,
the
so
other
what
way that you can just approach it is just to embrace it all.
I know I do, and I do think that's important. I think it's,
Mhm.
it's there are certain things I think that we can do to prevent it or slow down this
Mhm.
process. And there's still healthy aging, right? So that you can, I do feel like sometimes, women who are in their 70s that look like they're 30 or whatever, it looks weird as well. Like, you know what I mean?
Right.
Like your face
Totally.
should not be,
Yeah, yeah. That's the other thing too, is trying to like look natural, and not looking, yeah, you want to not look completely not your age. Which
Yeah.
by the way, you look amazing for over 50. That's
Bless
awesome.
you. Yes, 52. I'm going to be 53 soon. It's crazy.
Oh wow. Okay.
Um, so tell me, so what can we do? So what are some of the things that we can implement in our routines? What kind of treatments are available to people who
Mhm.
want to enhance, not surgically enhance, but like, naturally at home, do things to improve our skin.
Well, when it comes to a basic anti-aging skincare routine, I do think in the morning it's good to cleanse, use some type of antioxidant serum or lotion, and then if you're dry, a moisturizer followed by a sunscreen. In the evening, cleansing is even more important. And I'm actually a fan of the double cleansing method, just because it really ensures that your makeup and sunscreen are removed. And following that with a retinoid. So a retinoid is a vitamin A product, and it could be a prescription like Retin-A or tretinoin, or it can be over the counter like a retinol or Differin gel, which used to be a prescription, it's now over the counter. And what this does is it helps with collagen remodeling, which can help with wrinkles, but it also helps with the exfoliation process in the skin. It increases skin cell turnover, so you're creating more even skin tone. and following that with a moisturizer. So that would be like your super basic anti-aging skincare routine. And of course, there's a lot of other anti-aging things you can do, adding peptides to your moisturizers. There's a lot of moisturizing creams that have peptides. And then there's also growth factors. And then there's also exfoliation, like using an exfoliating cleanser a couple times a week or an exfoliating peel pad once a week. And then, of course, there's plenty of other things that you can do procedure wise. And everyone's different. So a lot of people ask, like, oh, when's a good age to get Botox? And it really doesn't matter. It's whenever you have a line that you see that is bothering you. And so some people can have no lines until they're 50. Sometimes I'll see people in their 20s with like really deep forehead lines. And so it's just up to the person. But Botox, Dysport, Xeomin, Jeuveau, those are the four on the market that are what are called neuromodulators that essentially paralyze the muscle to help with prevent wrinkle formation. But of course, we only use a small amount to make sure that you can still make facial expressions and all of that. And then I think once people get into their 40s, 50s, there's also filler injections, which is actually hyaluronic acid, because hyaluronic acid actually is a substance that lives between our collagen fibers. And so when people age, as things drop, right, things drop. So we restore volume in the upper face, whether it's getting just putting a little bit of filler in the cheeks, things drop. So this line gets accentuated as people get older. So we could just kind of soften those lines a little bit too. And then, there's also other procedures in the office, whether it's chemical peel, so just kind of help with the exfoliation process, lasers to help with pigmentation, also with wrinkles too. And then like things like microneedling, which can help with wrinkles.
Do you have any thoughts on LED therapy?
I think that there's some growing evidence for it. Initially, we didn't really see that much on it, so dermatologists were not wholeheartedly recommending it. But I think we're seeing more and more come out and some like pretty interesting at-home devices for that. So I do think that that's something to look into.
So what are some of and then in terms of lifestyle, I guess, don't eat sugar.
hmm Yeah, sugar and processed foods is the general theme for foods. I know I hate to tell people to go on a super restrictive diet because that's the other thing too. You also want to enjoy your life. If you're like so restrictive and stressed out by that can that can be aging too.
Eat
But the main
less.
thing is
Yeah.
sugar. Eat less sugar, processed foods. But the other thing that I want to say is eat more of, and this sounds so cliche, but eat more fruits and vegetables. Fruits, I think and I say it sounds cliche because we hear it all the time, but vegetables and fruits are literally full of nutrients and antioxidants that can help fight free radicals from the inside out. And that can make a bigger impact. And of course, there's been plenty of studies that have shown the benefits of various antioxidants. There's like lycopene, which is from like the red, purple fruits. Of course, vitamin C and resveratrol, which is from like grapes. We also see it in wine. Although I tell people alcohol, I think, can also be aging as well. So don't overdo it with the wine. So yeah, so yes, eat less sugar and processed food, but just be more conscientious about incorporating more fruits and vegetables into your diet, eating the colors of the rainbow. And then other aspects in life, I mean, sleep is super important, and that's something I need to do better with. But sleep is, yeah, obviously it's your body's chance to recuperate and regenerate, and minimizing stress as much as possible, and
Or find ways
just
to manage it better, whether
yes,
that's through
fine,
exercise or, yeah,
exactly. And that's another thing.
dancing on TikTok.
Dancing on TikTok and just not caring what people think. Um, yeah, and community also is really important. There was actually a really huge study done at Harvard that looked at like what's the one thing. Actually, this was more like what brought happiness. And out of all the things in life, and it was like community, whether it was family or friends, and just being able to have that like support group. And my mom, we're all here with her, and she has a couple granddaughters, so she's got a good group. with her, and she's doing pretty well for 72. Um, yeah. And there was another, oh yeah, going back to like just happiness and decreasing stress and mindset. Like mindset is the biggest thing. Actually, I was doing a TikTok live with my mom, and somebody asked a question like, what's the number one thing that you do? What's your biggest anti-aging secret? And my mom said dirty jokes.
Good for her.
Yeah, so just like having a good sense of humor too. And yeah.
Because it all shows up, when you hold in the stress or whatever ill feelings you may have, it does show up on your skin, and it just shows up in other ways, right? So, I mean, we try to suppress all that kind of stuff, but it'll manifest itself in some way, right?
Yes, definitely.
That's awesome. Any other final tips or things that you want to share about how we can, I mean, between you and your mom, forget it. It's like, you guys are the poster women.
Yeah. Oh, well, thanks. I mean, I know there's so much information out there. I think like when we're on our social media, we're just bombarded with like all these tips and advice and everything. And I want to emphasize that I don't want you to feel like pressured or obligated to follow all these things. I mean, we're all on our own path, and I think it's also important to like embrace where we are. But yes, if you're motivated to work more on your health and your skin health, these are definitely some things to consider, the stuff that we talked about today.